Hi friends, now I have the honor of introducing to you Dr. Kshitij. He is rank 17 in this November 2018 AIIMS exam and category rank 1. Heartiest congratulations.
Thank you, sir, and hello everyone.
How are you feeling today?
So I'm feeling great. It is a total relief to me getting a rank 17 and able to choose the branch that I would like to take.
Finally relieved?
Yes, sir.
Feeling, yes. Lack of stress now, no, totally enjoying it?
Just before the exam, it was so much stress, and just before the result too.
Yeah,
the
definitely.
duration between the exam and results was also stressful, but now relieved.
Very good, very good. So, Kshitij, I wanted to know from you, like you joined us in your test and discussion course.
Yes, sir.
So, how was your experience with the test and discussion course?
So, test and discussions, I attended the class in Delhi itself, in Karol Bagh, and the classes used to happen every week, and there was flexibility. You can attend. There are multiple classes, so you can attend whenever you would like to attend them, and the teachers are friendly, approachable. They used to clear the doubts. The test itself was very pretty oriented to the exam. Just like the exam is held in real situation, the test was almost similar.
And did you feel that in our test there were enough number of visuals questions and the clinical questions to give you enough practice?
Yes, sir. The questions, there were enough questions, visual questions, and especially the latest topics were also covered. So, especially in an AIIMS exam like AIIMS, where they ask a lot of changes, updates, the test and discussion was pretty helpful.
So you were, able to utilize that test, and before the test you used to study on your own and then give the test and followed by this. Did you interact with the teachers?
Yes, sir. Just after the test, the doubts which I used to have, I used to discuss with them and get them cleared.
So did you think that the course benefited you towards your goal?
Yes, sir.
And how did you approach the AIIMS exam this time? This time in AIIMS you had like a paper which was more doable, and you could apply a lot of common sense onto it. How many did you attempt in this paper?
So I attempted around 198 questions, and what I feel is everyone should attempt more than 190 questions with very few seats. It's worth taking the risk. And so this time what was surprise was video questions.
Yeah,
which came
video
in the
question
exam.
was surprise. Yes. So how did you tackle them? And were you surprised, or were you able to maintain your cool when looking at the video questions?
At first, I was surprised, like what they have asked. With that, the first video question I got was of some lava, and it was moving on the screen, and I thought what it is. But seeing the options, I could derive something out of it and do it. So video questions is not don't require any special attention, but if you have studied images properly, I think they should help.
And what about the visual question? They always form a significant chunk of questions in AIIMS. What was the trend this time?
So even this time there were around 25% visual questions, or I should say more than that. And seeing the photos that was there in DVT and all actually helped me.
So did you utilize those DVD slides for the visual revision?
Yes, sir.
So they helped you to formulate an idea on
Yes,
the
sir.
visuals. And I also want to know from you, like suppose somebody is aspiring to do well in May AIIMS. What would be your advice to them? Like what topics to focus on? Like you gave this exam. What topics did you feel were like being focused on?
AIIMS. There's a difference between November exam and May exam. November exam is a bit more on a basic level. The questions are a bit simpler. May exams, they go a bit deeper, but AIIMS usually does not deviate from the topics that they have been giving every year. It is the same topics like in surgery, instruments, trauma, breast. It's pretty sure there will be question from breast, there will be question from trauma, and they ask a lot of updates. Whatever the changes happen, like this year, even they asked from Nobel, who got the Nobel Prize. So you have to be updated that any changes that come. Around 10-20% is updates, and then they ask a lot of new drugs also. So the focus should be on updates and photos and basic.
Do you think test and discussion helped you to grab those updates
Yes.
and the visuals in between?
Yes, sir.
Yeah. So, like, if I ask you now that, somebody who is preparing for May AIIMS next, would you advise him to be at the same aggression level while attempting the questions as this time?
I would. What I would say, the November AIIMS people should be totally aggressive, but may a little bit conservative, but still more than I think 185 questions, because most of the people I don't know, like, it's what is called intelligent guessing. So other than 80 questions, 90 questions, rest of the questions people are guessing. Everyone is guessing. So
it's just like intelligent guessing, actually.
Intelligent guessing.
Yes, yes.
So
Tell us more about the difference between May and AIIMS. Like, what could you feel as a good ranker? What is the difference? You said that in May you felt the paper is more tougher as compared to November. What do you mean by tougher?
By tougher, I mean the questions are longer. In November, the questions are one-liners, whereas in May they are like the questions may be of one paragraphs. So you have to read through the questions very quickly, get the key points. That is how you have to solve the questions. Other than that, this time there were not many questions of mathematical calculations, whereas it could be expected in November, like calculating sensitivity and specificity and all mathematical calculations.
So even I have felt that this time, none of the rankers has, complained about time management. While in May, when you talk to students, they all say that it was tough to finish the paper. Here, I think most of the people who have gotten a good rank were able to look at the questions once more. Do you feel that, that is due to the length of the questions?
Yes, sir. Okay.
Yeah. So if I put it in one line, that the length of the questions in the November exams you felt was lesser than the May exam. Even I felt the same. And another thing that I felt was that the topic repeat and that the concept repeat was fairly decently present in this exam. So that also reduces the time that you spend per question.
Per question.
Were you able to do it twice?
I was able to, the first round I was able to do, the second round I did half, and then I tried to solve the questions which I hadn't done.
Like how many questions you could do in the first go?
First go I did around 120 questions, and second go it was around the rest of the questions I attempted.
Okay, so 120 you could go in the first go, that gave you the confidence, then you did the others, and you had already made up your mind that this is a doable paper, I have to be more aggressive.
Yes.
And that probably paid dividends also. Now may I ask you, which branch are you looking to take?
So sir, I'm planning to take radio diagnosis.
It's very good. So why do you want to take radiology?
So,
this time I think most of the rankers all are talking about medicine. I thought somebody should come and say radiology. Why radiology?
So it's a branch which is not hectic, which gives you ample time to have a personal life. It gives you time to do other things in life, like to pursue your leisure activities, hobbies. So that's the reason I want to take.
Plus another thing in radiology is that despite the time, the branch itself is very interesting. You'll see a lot of new things every day, and that keeps you interested.
You're right.
Yeah. And I also want to now find out from you, like you have told us a lot about how you went about things and all. Now how do you keep yourself motivated?
So
tough question I've asked.
What I do is whatever I want to achieve, I write it in a piece of paper and paste it in front of my bed. So whenever I wake up in the morning, I see that, and that gives
what was written in the piece of paper in the last 3 months?
You have to keep going, something like that. So that helps a lot in that boosts the energy in that.
So if I may put it in words, that writing down your goal helps you.
Yes, sir.
Does that because what I feel is when you write down something, you bring that thought into the true universe. Now it is in the pen and paper, it is there, and then you look at it again and again, and you get that circle of motivation.
You have to do it.
So you had that written goal that you wanted to do well in exam. Were you always thinking that you want to give this exam for radiology, or after the rank you're thinking?
I wanted to do it for radiology.
So then it's like probably a double victory now, that you can take a branch of your choice, and plus you in the best institute possible. AIIMS in particular, the radiology department is very good, and you have exposure onto subspecialties as well as neuroradiology, cardiac radiology. You get exposed to everything.
Yes, sir.
And any particular teacher that you want to mention today that impressed you during the time you spent in DAMS in the test and discussion course?
Dipti ma'am's class were very good, and she used to tell everything in a very simple manner, which was easy to grasp.
And I would now put you in a corner and ask you to say some motivational line for future aspirants.
What I would like to say to all the aspirants is that be determined, keep your goals clear, and keep working hard for it. Everything is achievable if you try, if you give your best.
Everything is achievable if you give your best is the message that he wants to give you. And with this note, I wish you all the best, Kshitij. It has been a pleasure interacting with you. I also want to take this opportunity to convey my regards to your parents. I'm sure they must be very happy and relieved that now we will have a good radiologist, and I'm sure we will meet in future in radiology events as well.
Yes,
I wish you all the best.
Thank you.
Congratulations.
Thanks.